If you're struggling to find ADHD medicines at the pharmacy for your child, watch this video. Hello everyone and welcome to the channel where we endeavor to educate, equip, and encourage anybody who's raising a child with a special healthcare need. I'm Dr. Nate Noble, a developmental behavioral pediatrician and clinical geneticist, and I'm making these videos to help you skip the line. In this video, we're talking about a very common problem that's very prevalent in the media now, as you can see from these news clippings. There are multiple reports of ADHD medication shortages across the country. And there are several reasons for this that are reported. We don't exactly know why there's a supply chain shortage, but there are some hypotheses, some of which I greatly disagree with, like this one. I do not believe that ADHD medication shortages currently are due to a miraculous uptick in prescriptions. I've been busy treating ADHD in my clinic for 20 years. It's the same as it's always been. So I don't know why there's these supply chain problems, but what I do know is that the problem is likely your problem. Tell me if this is you. Your child has been maintained on a medication. They've responded adequately to this medication. The dose is good. You feel good about it. We finished the school year strong. We're going to continue on the medication over the summer. And then you go to get your refill at the pharmacy and the pharmacist says, we don't have it. We don't know where it is. It's not here. It's gone. We don't know what to do. Call your doctor. That is the frustrating situation that so many of my patients have experienced. In this video, I'm going to give you 8 things that you can consider doing to deal with the medication shortage to help your child right now. So that being said, let's get started. Number 1. Consider a transition from a generic form of the medication to a trade name form of the medication. We have done this multiple times. And in your part of America or the world, it may work the opposite, where you're on a trade name medication like Adderall or Concerta or Vyvanse, and then you find out that that medication isn't available. What you have to understand is that these medications have 2 names. And the pharmacist will fill whatever name I send. So if I send Adderall, trade named Adderall, to the pharmacy, Adderall XR 30 milligrams, your pharmacist is going to look in the bucket where Adderall XR 30 milligrams should be. If they don't see it there because there's a supply chain shortage, they will say, we don't have it. But there may be another bucket right next to the bucket that says Adderall XR 30, and that bucket is called amphetamine / dextroamphetamine XR 30 milligrams. Guess what? They're the same. Now, some people are going to disagree. Some people are going to push back. Some people will say, oh, I've been on the generic of this medication and it never works the same as the trade. And I've been on the trade name. I've been on Adderall XR and I switched to the generic and nothing went right. Nothing went good. And I understand there are people who believe that, and I'm not debating that. But what I want you to understand is start with seeing if your pharmacist has the other version of it, the other name of it. So if they don't have Adderall XR, do they have amphetamine / dextroamphetamine XR? If they do, ask your physician to send a script for that. Number 2, think about switching medications. I know how hard this is. I know you've tried 50 and it's frustrating. And now I'm telling you to try another one. I know how this sounds, but please, you have to understand that these medications have very similar effects on the brain. If you don't know what I mean and are curious about what effects these are, please go watch this video. I'll link it above where I explain how these medications work. You have to understand that there are some nuances, but by and large, these medications are very similar and how they affect the brain. Now, there are some differences in terms of how your child may respond to these medications, but sometimes in the midst of a shortage, it's worth a change. As an example, you might be on Adderall XR 30 milligrams, and you might try and switch to Vyvanse. Now, I know that there are Vyvanse shortages as well. You might consider a switch from an amphetamine product like Adderall to a methylphenidate product like Concerta or Focalin, which is a dexmethylphenidate product. There are options on other side of the fence that have very similar effects on the neurochemistry of your child's brain that might not be a shortage. And I know it's scary and I know it's a jump, but if you're working with a seasoned clinician, it's not a jump. We're good at using all of these medications, and it's no problem to transition from one that you can't get to one that you can. Point number 2, consider changing medicines. Point number 3, consider using the short-acting version of the medication that you're trying to find. If you can't find Adderall XR 30 milligrams, could you find a short-acting Adderall 15 milligram tablet that you could take twice daily. I know it's a little bit different, and yes, there's going to be, different peaks and valleys, and the efficacy won't be quite as maybe effective or as stretched out or as beneficial as it has been on the XR version. The administration is not quite as smooth, but sometimes you've got to get through, right? Desperate times call for desperate measures. If they don't have an Adderall XR 30 milligrams, do they have an Adderall short-acting 15 that you could take one in the morning and one at noon? Something to consider. Point number 4, if they don't have the dose that you're seeking, so again, they don't have an Adderall XR 30 milligrams, do they have an Adderall XR 15 that you could take 2 in the morning? Do they have an Adderall XR 10 that you could take 3? I know this is a stretch. They have an Adderall XR 20 and an Adderall XR 10 that you could then take both together in the morning. I know this is complicated and you're thinking that just makes my life harder, but please understand that there are creative solutions, and all you have to understand is math. Do the sum total of the doses add up together to equal the dose that you're trying to achieve? If the answer is yes, that's probably a strategy worth trying. Point number 5. Okay, now listen, don't throw anything at the computer screen, okay, when I say this. But maybe it's time to consider, if you can't access a stimulant medication, and again, if you don't know what I mean, go watch some of my other videos, but if you can't access a stimulant medication like Adderall or Vyvanse, consider non-stimulant options. Now, what do I mean by that? There's several non-stimulant medications that maybe don't have quite the supply chain problem that traditional stimulant medications like Adderall do. An example would be Quellbree or Strattera, or there's other options like Clonidine or Tenex, or the long-acting version of those medications like Capvay and Intuniv. Now, these medications are different in their mechanism. They don't affect weight. You can take them in the morning or the evening. They don't tend to have some of the frustrating side effects of the more traditional ADHD approaches, but also the efficacy of these medications might be a little bit different. But sometimes in the midst of a drug shortage, maybe it's time to consider a non-stimulant option. Number 6, maybe, just maybe, we look at other pharmacies. Now, typically a good pharmacist will help you do this. They'll call around to find another Medicap or another Walgreens or another whatever and see if they have it somewhere else in the city. And if they do, that's great. You can call the office and then we will send it to the place where they do have a supply. Sometimes all the pharmacy locations that you have picked don't have it, but you get on the phone and you call around yourself and find out that the Walgreens does. So sometimes you have to change the pharmacy. You have to go where the supply chain leads you. Please understand that when calling your regular doctor's office, it's not difficult to change where we send these medications to and which pharmacy receives them. All the pharmacy has to do is be equipped to receive electronic scripts, which almost all pharmacies are, and all it takes from us is the click of a button. So don't feel bad about asking us to change the pharmacy. If you found where you want us to send it, tell us and we'll do it. Point number 7. Now, as we go through this list, the farther we go, the more we're kind of scraping the bottom of the barrel. Number 7 is consider rationing the dose. Okay. In the summer, I always tell families, listen, my favorite thing to do in the clinic is to take kids off medicines. If I can take you off of medicine, I will. Sometimes in the summer, it's not a bad idea to think about landing the plane and giving your child the opportunity to kind of reestablish their baseline norm in terms of their neurocognitive status and the way their neurochemistry works, and just come off medications. Now, some of you are listening to this and thinking there is no way we can do that. But if you're faced with a drug shortage and you can't get access to these medications, sometimes your hand is going to be forced and you're going to have to ration these medicines, in the sense that what I mean is you use them on the days when you need them most. I know that when a child is on high doses of medication, so example, Adderall XR 30, Adderall XR 40, Vyvanse 60, Vyvanse 70, those are high doses. It's difficult and I don't recommend going on and off dosages that are that high. But if you have lower dosages, you can talk to your physician about ways to ration these medications. Maybe you only need them on the 5 days of the week when the child's at day camp. Maybe on the weekends we don't need to optimize your child's ability to attend to tasks, we can give their brain a little breathing break, give them a little more calories, go jump on a trampoline and live their life. So the point here is that consider rationing these medications if the dosage is amenable to them. And that is a conversation that you have with your prescribing provider. Number 8, and you can probably guess that I'm going to say this because I alluded to it in point number 7. Consider a straight up drug holiday. It's not a rationing where you're only giving it sometimes and not giving it other times. Sometimes you just say, look, if they don't have an Adderall XR30, but they do have some Adderall XR10s, maybe I'll just take 2 10s for a week, and then I'll take 1 10 for a week, and then we'll just land this plane and we'll just deal with whatever comes through the door. We'll just live our life. But know that if you choose to come off the medication and you work with your provider to come up with a weaning strategy that works for you based on your dose and your child's needs, it doesn't mean that you're just free and exposed to the elements and now you've got this morbid, impulsive, hyperactive, and inattentive ADHD that's just kind of to the wind. But there are other strategies that you could use to treat ADHD that are more naturalistic, more holistic. Examples will be behavioral therapy. Now, there's a lot of emerging data about the importance of behavioral therapy and working with your child to train their brain to focus and attend to tasks when it's necessary. Information about omega-3 fatty acids has been around for a long time, and people have been supplementing their children's diet with this with some benefit for many, many years. It's safe and it can be effective, and it certainly can be healthy. And let's not forget about the age-old dietary restriction. We try and remove some of these processed foods, these packaged foods, these foods that come from the middle of the grocery store instead of the periphery of the grocery store. And that can also include, increasing the amount of protein that the child is intaking, supplementing with more organic or less processed foods in general. These are things that have also been shown to be beneficial. And lastly, let's not forget about vitamin supplements like iron, vitamin B6, zinc, vitamin C, and many others that can be very helpful in helping your child regulate their hyperactive and impulsive features. I sincerely hope this has been helpful to you. If there's been any value, like and subscribe, because we're going to keep making these videos no matter what, so we can get information to you and the people that you care about. Thank you for your time, and check out our other videos for more information.